Today, we are talking about post-traumatic stress and how it can affect you. Hi, I'm Dr. B, and I want you to fully enjoy life and experience the freedom that God desires for you and also those around you. You know, post-traumatic stress is considered a mental health condition that seems to be caused by a distressing and terrorizing event, either experienced yourself or you witnessed the incident. Here's what can happen. You can experience or witness a traumatic event and then have a difficult time coping in life. What we've learned is with time and self-care, you can usually get better. But if your symptoms continue to get worse, say lasting for several months or even years, you may have post-traumatic stress disorder. If you cannot get through your day-to-day living, you will need help. And here's what we've learned about PTSD. Symptoms may start within about a month of the event we experienced. Sometimes, though, symptoms may not even appear until a year after the event. The PTSD indicators can actually cause major problems at home, at work, and in our relationships. They can also interfere with your normal day-to-day activities. There are several types of trauma that can cause post-traumatic stress. The one that I've worked with as an Army chaplain would be war trauma. After World War II, soldiers would come home and have a tough time adjusting to normal life. It was called shell shock, which would cause soldiers to feel jumpy, especially at loud noises due to battles they were in. I remember as a child, some of my uncles who served under General Patton and how the war changed their lives. I worked as an Army chaplain several years after the Vietnam War, and I was a chaplain for the Missouri National Guard in Jefferson City, Missouri, while I served as pastor of the Concord Baptist Church in that city. There were several Vietnam veterans that were in the battalion I served in who were experiencing PTSD. At that time, we did not have the education we do today to help those suffering due to trauma. I was able to use my counselor training and guide the soldiers through their difficulty. What I noticed was the alcohol and drug abuse by veterans who were trying to cope with their past. So war trauma is one way people experience post-traumatic stress. As a counselor, I've seen many people through the years that have experienced post-traumatic stress due to, I call it domestic violence. I can recall many women that were abused by their husbands and they carried the signs of PTSD. So they were guided through how to deal with their past and especially triggers that can debilitate them. Childhood abuse, physically or sexually, is another type of trauma that can create PTSD and especially triggers that can cause relationship issues. Some even bury their childhood abuse and not think about it, but they still deal with the triggers and emotional distress. Rape and sexual abuse is a big one I've probably dealt with the most as a counselor. In fact, when I led a large counseling ministry, I had an entire department that was used to help women who have been raped or sexually abused. I had women trained, in fact, most of them were healed from past sexual abuse themselves, that helped others become whole again after their rape or sexual abuse. Natural disasters can also cause PTSD. Disasters like tornadoes, hurricanes, earthquakes, flooding, and so on. Several years ago, I led a mission group from my church to Haiti after their major earthquake and hurricanes. My team saw the devastation and were able to help people over a 3-year span with their physical as well as emotional difficulty. I was fortunate to have a great interpreter who helped me in Haiti. Car accidents can also cause PTSD. This is actually something that happened to me in 1999. There was a drunk driver who ran a red light, hit my car, and not only totaled my car, but knocked me unconscious due to the hard hit. I woke up in the back of an ambulance and, in fact, have had 2 back surgeries due to my injuries. My triggers were even driving a car or even loud noises. I'm much better now, except for my back pain. My last back surgery, in fact, was just a few months ago. Witnessing a traumatic event like murder, suicide, or any other violent event can cause PTSD. I know serving as a police and fire chaplain, I've been called out and worked with family members who deal with suicide. I remember one that a husband and wife were having marital issues, and she decided to go out and be with some friends at a bar. Her husband called her and said, "If you don't come home now, I'm going to kill myself." She didn't believe him. When she arrived at home, hours later, she opened the door, and there her husband was hanging by his neck right in front of her. Now, she had to have a lot of therapy following that event. I've actually been to counseling for all that I have seen through the years. And while in college, I worked in a local funeral home, and my job, like I said, was to pick up dead bodies. Over 4 years, I saw many types of death, many who had died in violent ways. As a police and fire chaplain for the past 30 years, I've seen multiple suicides, car accidents, airplane accidents, and even murder. And what I've learned to do is like place a file in my mind of each event and only think about it when I choose. What PTSD can do is like take over your entire mind, and all we can think about is that tragic event. So what I teach people is that our minds are like the old style file cabinets, and each file is a memory. When you're healthy, you have these memories filed properly, and like I said, you can pull out that file and see the image in your mind when you choose to. Again, what post-traumatic stress does is take over the entire filing cabinet, and when triggers happen, you automatically see that image. You have no control. Traumatic grief is another cause of post-traumatic stress. If you've been listening to my story through Finding Freedom, you know that in a 1-year time span, my dad died at the age of 53 on our farm with a major heart attack, and my brother died on our farm with a 3-wheeler accident at the age of 24. And I felt responsible for his death because I built the racetrack and he died on it, and I got him started into racing. So I carried those memories and experienced PTSD symptoms for over 10 years before I had what I would refer to as a train wreck in my life. Now, following extensive counseling, I was able to make the appropriate files in my brain, and am doing much better. Now, another cause of PTSD is severe medical illness like HIV and now COVID-19. More and more people are contracting COVID-19 or has family members or friends that have died of this terrible disease. I know I performed the funeral as a police chaplain of one of our Claremont police officers who died of COVID-19. And I counseled with his wife for several months over the computer following his death. I've also had friends and church members who died of COVID. Now, I have been diagnosed with PTSD, also due to my heart issues. I struggle with the same disease my dad died from, heart disease. I also deal with AFib and RVR. And in 2011, I was dealing with a heart issue, placed in an ambulance, taken to a hospital in Orlando to put a stent in my artery. During the procedure, they lost me and had to shock me to get me back. That experience alone has caused a lot of triggers for my PTSD. In fact, every time I go to a doctor or hospital, my blood pressure, my heart rate goes to the ceiling due to anxiety. Some call this a white coat syndrome. But I do trust God and ask His help in dealing with PTSD. But it is a struggle due to my medical issues. I feel I'm able to help others now with PTSD due to my own struggles. Now, there are other types of trauma that can cause PTSD, but I've listed the ones that seem to be the most prevalent. Now let's turn our attention to see if you are experiencing post-traumatic stress. Let me try to answer, what are the symptoms of PTSD? I think the first symptom that many experience would be reliving traumatic events. Some call this flashbacks. It could be nightmares or any disturbing image about the trauma. Some experience intrusive, disturbing memories, which causes anxiety and stress. Some will spend their time avoiding reminders of the trauma. Those who suffer with PTSD will avoid places, especially where the trauma happened. They may also avoid people or even activities that could remind them of the stressful event. I've also found that many who have PTSD will avoid talking about the experience. And this is especially difficult because counseling is such an important part of overcoming PTSD. I think hypervigilance is also seen as a lifestyle of people with PTSD. They can easily be startled, irritable, jumpy, or on edge or nervous. It's been proven that high levels of stress hormone is running through the body of those dealing with post-traumatic stress. Many will have a difficult time sleeping and are always in like this hyper-alert state of mind and being. Another symptom would be emotional numbness. So many with PTSD experience a detachment and feeling numb. Also, it's been seen people with this disorder also having trouble concentrating and not enjoying activities they once enjoyed, which can lead to depression. Now, all these symptoms can cause hopelessness about the future, which leads to many with PTSD that, sad to say, die by suicide. Now, it's normal to experience a wide range of feelings and emotions after we suffer a difficult or traumatic event in life. You can feel sadness, some anxiety, fear, or lack of focus, a change in sleeping and eating habits. You can have experienced bouts of crying and recurrent thoughts about the event. But if you have to deal with these difficult, disturbing feelings for more than a month, and they are severe and to the point you feel like you're having trouble getting your life back, please consider talking to a health care professional who knows how to deal with PTSD. If you are severe and have struggles over a long period of time, PTSD may become disabling. Now, I will continue to share in my upcoming videos specific stressors and how to deal with your post-traumatic stress symptoms. Now, the Bible doesn't say anything specific about post-traumatic stress, but we can glean guidance about how to focus on the things of God. In fact, listen to what Jesus says to us in John 14:27. Peace I leave with you, my peace I give you. I do not give to you as the world gives. Do not let your hearts be troubled, and do not be afraid. Hey, thank you so much for watching this video. If it was helpful, be sure to hit the thumbs up button. Also, be sure to subscribe and click the bell icon so you will always know when we post new content. Have a wonderful day as you continue finding freedom in your life.